And thank everyone for joining. I know people are still coming on, so we'll kind of hear some of these dings throughout the time here. But I want to just start by introducing myself, who I am here at Empower Sleep, introducing Dr. Chopra as well. And we have some fun and interesting questions that we're going to bring up. You guys have submitted some wonderful ones already. So this is a very laid back, very hopefully exciting process. And so please don't feel nervous or scared to ask any questions. We're all gonna have fun here. All right, so let's begin. Thank you for joining our webinar here. Why you're still tired after 8 hours of sleep. My name is Callie. I'm one of the sleep coaches here. And just a little bit about myself. I was doing the math earlier to tell you guys how long I've been in the sleep field, and I'm over 25 years now. So I've been in the sleep field since 2000. I started off as a traveling sleep technologist, and I've had so many cool opportunities since. And one of the things I love about Empower Sleep, and specifically Dr. Chopra, is the amount of knowledge that we have as not only individuals, but as a corporation. It's just been so fun to grow at my time here at Empower Sleep. All right, but enough about me. I want to introduce Dr. Chopra. He is our Chief Medical Officer and co-founder here at Empower Sleep. And Sahil, I'd just like to ask you maybe just to give yourself or give us a quick introduction about who you are and maybe give us a little information about what brought you to become interested in sleep in the first place.
Yeah, no, first of all, thank you, Callie, for being on the team. Thank you, everyone, for joining, taking time out of your busy day. I had pretty humble beginnings. Started off as an internist, did residency at UCLA. I worked as a hospitalist for a few years before going back to doing pulmonary critical care medicine. Luckily, I did that at Loma Linda. And for those of you who are longevity enthusiasts, you know that Loma Linda is one of the blue zones in the world. People tend to live longer, and I think that's how I became a little bit curious about wellness from working in the ICU. And after that, during that time, there's this big overlap between pulmonary medicine and sleep apnea because it's a breathing problem when someone sleeps. And I became really interested in sleep medicine. So I ended up doing a sleep medicine fellowship. The other thing that also happened to me is when I was in fellowship, for those of you who've done medical training, um, you work a lot. You spend like 70 plus hours a week at the hospital. Um, we had two kids under the age of two during that time. And then I was really sleep deprived. I would like sleep in the car before I would go home. I wasn't like in the best like mental health, and I just became really deeply interested. Matt Walker's book, Why We Sleep, had just come out around that time, and I just became really interested in like sleep physiology, the importance of sleep beyond the idea of just sleep apnea, and how it influences our overall health. And that was kind of my segue into doing a sleep medicine fellowship. That was my story. I didn't have a lot of research. It was just the passion of wanting to learn more. And somehow I matched at Harvard, was in Boston for a year, and have been stuck to sleep ever since.
And real quick, what brought you to kind of create the idea of Empower Sleep in the first place?
Yeah, I give all the credit to my mentor, Dr. Robert Thomas. One of the things that he's like, for those of you guys who are like dentists or physicians, um, a lot of sleep medicine gets distilled down to like sleep apnea medicine. And even though that's a really common problem, that's not what sleep medicine really is. Uh, like sleep medicine is supposed to be the understanding of human physiology when someone sleeps. So it's like what happens to your brain when you sleep? What happens to your neuroendocrine system when you sleep? What
What
happens
happens
to
to
um, your cardiovascular system when you sleep, your GI tract, your rest and recovery. And so it's like all of these micro processes that are happening across your entire physiologic system when you are sleeping. And um, in the community, that's not what's happening. In the community, it's like you worked as a sleep technician, right? Like the biggest question people ask is this sleep study positive or negative for sleep apnea? And it's kind of you have all of this data over 8 hours, and it gets used as like used for a binary question. is does someone have sleep apnea or not? And it's a fundamentally flawed question to ask. The better question to ask is what is happening to your sleep physiology when you are sleeping? And then you can start to identify, oh, do they have apnea? If so, what kind, what stage of sleep? If they have insomnia, what's the root cause? What's driving it? If they have movement issues, like what's causing it? If they have a nutritional deficiency, if they have a hormonal deficiency, then you can start to see the person as a whole person, not just like they're doing a sleep study to identify sleep apnea. And because that wasn't happening, I just decided that let's, try to figure this out on our own. And that was essentially the inception of Empower Sleep.
Oh, that's awesome. Thank you so much for that. Now, I understand we have a presentation coming up next, but I just wanted to remind everybody that this is an Ask Me Anything process. And so, as time goes on, if a question does pop up, don't hesitate to click on the chat icon and send us your question as this experience is happening. We also got some questions submitted from you guys prior to this as well. So, we'll pull up some of those questions. And again, any questions that happen as time goes on, feel free to put in the chat. All right, Dr.
Thank
Sahil,
you.
I'll throw it back to you.
Thank you. Thank you. Let me go ahead and share my screen. Um, Let me know if you can see my screen.
Yes, we can.
Yeah, okay, thank you. This was a metaphor, and I think like if everyone on this call today understands the metaphor that I want to share with you, you'll start to value your sleep in a fundamentally different way. If you're a physician, you'll start to see sleep in a different way from a more physiologic lens. And this was introduced to me by one of my attendings. And he used to say, like, imagine like you go to Disneyland and you're the first person to get there every morning. And even though Disneyland is, I don't know, it's like 70, 80 years old, it still looks brand new. It's like matured really well. The trees are beautiful, the buildings look new, the floor is clean, but it's a really old place. And despite there being thousands of visitors on a daily basis that come in and out of Disneyland, and at the end of the day, it's left dirty. There's like food on the floor, there's gum on the windows are dirty, the trash cans are full. And when Disneyland like closes, and we leave, like what appears to be closed to us, it's actually not closed. It's shifting. Like everything, like the roller coasters are off, but something else is happening at the roller coaster. Something else is happening in It's a Small World. Something else is happening at the log ride. And someone is trimming the bushes, someone is cleaning the floor, someone is cleaning the window, someone is uh, taking out the trash. And it's just shifting from what is happening during the day to what is happening during the night. And and I thought that was like a really powerful metaphor because then that allows us to look at sleep through that lens, that sleep is like the housekeeping process or the maintenance process for our entire physiology. And anything that disrupts that process, whether it's a hormonal issue or if it's a sleep apnea issue or a restless leg issue or nutritional deficiency or stress or anxiety. And, there's a long list of things that influence our sleep in a positive way or a negative way. But if we start to see that sleep is the housekeeping process for our body, then it becomes like a foundational pillar for our overall well-being. And I have like two slides that I want to show you, um, where, you know, when you look at the physiologic functions of sleep and you track them across a 24-hour period, what you start to see is like, wow, core body temperature really changes across a 24-hour period. When someone is sleeping, the filtration in their kidneys is changing. The blood flow in their brain is at its peak when someone is in deep sleep. And this is really critical because there is so much evidence now that suggests people who have insufficient uh, non-REM or deep slow wave sleep, they're at a higher risk of having Alzheimer's dementia. And when blood flow to the brain is at its peak is when the lymphatic system in the brain is functioning at its peak. And it's during that time that beta amyloid, which could be a precursor to Alzheimer's disease is filtered out of the brain. So blood flow to the brain is at its peak. Blood pressure during sleep is supposed to be the lowest. Melatonin during sleep is supposed to be highest. Cortisol, you see, like when we go to bed, it's lower at the end of the day and it starts to rise as we start to wake up. Thyroid hormone peaks, growth hormone peaks, and growth hormone is critical for recovery. Thyroid hormone is critical for metabolism. So when you start to see that, man, sleep is broken, or sleep is ineffective, or it's being cut short by 2 or 3 hours on a nightly basis, or it's being interrupted, you can start to then understand why people who have bad sleep don't feel well, why they have fatigue or brain fog or uh, a whole list of chronic medical issues like hypertension, uh, cognitive decline, insufficient recovery. They're not able to break a ceiling on their VO2 max, or they're not able to break the ceiling on their HRV. Like it's a very long list of both like physiologic changes that one is not able to achieve, as well as the development of chronic diseases that stack up over time. And here's a really I share this graph in almost like all the talks that I give because I think it just drives the point home. And there's two things here. And uh, the first graph here, this is looking at all-cause mortality in Asian men. This is out of JAMA. It's a high impact factor journal for those of you who are non-clinical. And they looked at about 320,000 people. And what you see is like sleep duration is on the y-axis, and the likelihood of mortality in the form of a hazards ratio is on the y-axis. So the x-axis is sleep duration, the y-axis is the likelihood of dying. And people who sleep less than 5 hours, or people who need to sleep more than 9 to 10 hours, have a higher mortality. And this isn't across like 1,000 people. This is 300 and some odd thousand people. And this U-shaped relationship is the same U-shaped relationship that we see with blood pressure. It's the same U-shaped relationship that we see with blood glucose control, meaning that there needs to be a homeostasis. If blood pressure is too high or too low, mortality is higher. If blood sugar is too high or too low, mortality is higher. If someone needs too much sleep or needs too little sleep, mortality is higher. So it's a clue, it's a signal, it's a window. Just by looking at how much people sleep, it gives us a clue of like what is their overall health. The other metric that is really powerful. And this is where like this whole idea of like 7 to 8 hours of sleep comes from, is like people who we want to stay within like a homeostatic space. The other thing that's really critical, and you probably have heard of this, is like the importance of sleep regularity. And this is coming out of the UK Biobank data, and I think it's like 60,000 folks. And what they looked at is what is the proportion of the question that they asked was, what is the proportion of people who survive who wear a wearable at the end of 8 years, depending on their sleep-wake patterns? And if you look at this first group here, this is like 7 days of sleep data from a wearable device. Each of these bar represents sleep, and you can see that this person is regular between 10 p.m. to maybe 8 a.m. And when someone is regular, they have a higher proportion of them are surviving at the end of the study versus those who have completely irregular sleep. And so this emphasizes the importance of the circadian rhythm. So like a lot of what I tell patients is, what are like the two things that you can do that are probably the most impactful for your sleep? One is like give yourself an adequate amount of time for sleep. And the second is have as much regularity as you can around your sleep, because the circadian system is is a it's our physiology that modulates across a 24-hour period for everything. You saw in this like last graph, some of these things are sleep dependent, some of these functions are circadian dependent. So our blood pressure is circadian, our nutrition is circadian, our appetite is circadian, our cognition is circadian. Everything has a peak and a trough over a 24-hour period. And our emotions are circadian. So if we have a healthy circadian system through regularity of like darkness and light, our overall health starts to get better. And there's a really good book by a researcher out of the Salk Institute, Dr. Sachin Panda. I would encourage you guys to, it's a really easy read. I read it in fellowship, and it really talks about the importance of uh, the impact of the circadian system all the way down to the point of the administration of like if I give a chemotherapeutic agent to someone who has breast cancer during the day versus during the night, the outcomes can actually be different. Because like how these drugs are metabolized in our system is different. It's circadian. So these are probably like one of the two most important levers that one can do from a sleep optimization standpoint. After that, all the other things come. But I just want to emphasize how important these two studies are. Um, why most of us, for those of you who are just joining, my name is Sahil. We have Callie, she's one of our sleep coaches and hosting the webinar today. And you're here to sort of talk about, to learn, like, if I'm sleeping 7 to 8 hours, why do I still feel tired? And that's a really common question that I get in clinic at least once a day. And and like people think that it's always a sleep issue. And I'm here to tell you that it's not always a sleep issue. Fatigue eh, could be a byproduct of so many different things. Sleep is one of them. It could be, and like the framework that I try to share with patients is one of it could be a sleep related issue, meaning you're not getting enough sleep because of either insomnia, sleep apnea, some sleep disorder, or it could be like something along your chemistry or hormones is off. There's a hormonal deficiency, thyroid levels are off, there's iron deficiency, vitamin levels are off, blood sugars are dropping, cortisol is not where it's supposed to be. These are all reasons for people to feel tired during the day. Or it's a mental health thing. Like there's plenty of evidence in people who meditate, who are yogis, who are in like phenomenal mental health, and they're able to function and do really well with 4 or 5 hours of sleep. And I think like having an unhealthy mind, we've all probably been sad at some point in time, and our sleep physiology changes. Some people sleep less, some people sleep more. So, but it does make us feel tired. Anxiety, depression, chronic stress, burnout. These are like the common causes that influence our mind. And lastly is the category of like chronic medical conditions. I had a patient 2 weeks ago, lives in Hawaii, has severe sleep apnea, but also has heart failure, and recently was diagnosed with a malignancy and is really stressed out about that. And like what you start to see is people don't like people are humans are not textbooks. Everyone, like, they don't fall into a specific category. And it's very common for people to have like multiple issues going on. And one of the jobs of their clinician becomes like, let me sort of unpack and figure out what is like in order of uh, in order of weight or priority, what do I think are the primary drivers of why this person is tired? And sleep is a big component of it, but I want to like just emphasize that it's not always sleep. I get patients often who have like very minimal sleep disruption, and they anchor on this diagnosis of sleep apnea that, hey, this is why I'm so tired. But then you do a more comprehensive body panel and you figure out that their sex hormones are off, their cortisol is off, their thyroid is off, and they have iron deficiency. And if you talk to them over a couple of visits, you realize, man, this person is extremely anxious or extremely depressed. So like, sleep is critical, but there are usually many reasons why people can feel tired or fatigued. And if it is like a sleep issue, like let's say let we've ruled out all the other things and we think that it is a sleep issue that's driving their sort of fatigue. Um, I want to introduce you to like sort of this kind of a framework to some extent, where if it's a sleep issue, the question becomes, is it like a circadian issue? Is it like their circadian rhythm is off? Like there was a time where I was doing a lot of night shifts and day shifts. And even though my sleep when I slept was healthy, I didn't feel rested because like my circadian rhythm was completely off. I would do a weekend of night shifts and then do a week of days and do a weekend of night shifts and a week of days. So I was like perpetually jet lagged essentially. So the circadian system plays a significant role in overall how we feel when we wake up. Is it a respiratory issue when we're sleeping? And respiratory sleep apnea is like a very easy way of simplifying things, but it's much more complex. Like the folks that are dentists here who are doing sleep and airway centric dentistry, they know like the craniofacial anatomy, the position of the tongue, the health of the joints, of the TMJ, the strength of the upper airway muscles. Those of us who are ENT physicians know, like, the inability to nasal breathe, how much that results in the the predisposition of developing conditions like impaired breathing during sleep, particularly sleep apnea. The other thing, those of us who are coming from the mental health space or psychiatry or psychology, we're aware that the autonomic nervous system plays a phenomenal role. So one of the metrics that we measure during sleep is called the sleep quality index. It's a little bit misleading in the sense that it makes one think it's talking about the quality of sleep, but it's really just a measure of what is the autonomic nervous system health when someone is sleeping. Um, if that number is very high, they're in a very much of a parasympathetic predominant state. If that number is very low, they're in a more sympathetic overdrive state. And when we're sleeping, we should be in a parasympathetic predominant state. And if we're anxious, if we're depressed, if we're stressed, or sleeping in a new place, that modulates our autonomic nervous system. And some of the terms that we use in sleep medicine are like arousal threshold, any conditioned arousals that one might be having. So people who have insomnia, their autonomic nervous system becomes a target to help them sleep better. And then you have like these behavioral and environmental issues. You probably heard, like, patients will say, I do my bedroom temperature. I have an 8 sleep mattress and my bedroom temperature is 65 degrees and I have blackout curtains. So these are all like, components, but it's never like one fix that solves a problem. And the combination of a healthy physiology, a good environment, a healthy autonomic nervous system, healthy breathing, and a healthy circadian system, when all of this sort of comes together, that's when people can actually sleep better. And it's so much more beyond the idea of just like, am I getting 7 to 8 hours of sleep, or do I have sleep apnea or not? And this is like the framework that I like to share with patients. Um, and that's kind of it. I'm not going to, maybe I'll do this last slide because I think it probably is useful. Feel free to take a screenshot. What are like the 10 most common reasons why someone feels tired during the day, even if they have reasonably adequate sleep? And stress anxiety is a really common driver. So mental health issues, stress, anxiety, depression. Iron deficiency is probably one of the most overlooked drivers of restless sleep. And we order this often in clinic, and the ferritin or the iron levels are really low, especially, where this is probably the most important is like the middle-aged perimenopause female who has these like hot flashes, also has mild sleep apnea, and also has iron deficiency. And so, like, making sure that iron is well repleted is critical. The changes in sex hormones as we transition from a reproductive age group to a non-reproductive age group. Um, CGMs have been really powerful in understanding blood sugar dysregulation, continuous glucose monitors, that these can really cause disruption in sleep. I mean, I would invite you to get a continuous glucose monitor, have a big meal before you go to bed, and see how your blood sugar is, and not have a big meal before bed and see how your blood sugar is. And you'll see like these really marked changes for most people. Vitamin D deficiency is extremely common driver of feeling fatigued during the day, as well as it can disrupt sleep. Having just an extremely sedentary lifestyle. The days that I'm just doing telemedicine visits and meetings, I don't sleep as well. The days that I exercise or ride my bike to work, I feel better, sleep better. Consuming alcohol. This is probably one of the most common drivers of sleep disruption for many people. Medication side effects, this easily gets overlooked, and I would invite you to upload all your medications to Claude and see, or Chat GPT and say, hey, which one of these medications could be causing a disruption in sleep? We're very uh, keen on taking new things like supplements, medications to sleep, but um, sometimes the drug-drug interactions will cause sleep disruption, and then other sort of nutritional deficiencies, whether that's B12, folate, iron, and so forth. So I'll kind of like stop here, and I would this I thought would be a fun slide to share. I took the last year of my sleep data and I kind of graphed it out. So this is each of these bars represents a night, and um, eh, and 180 days here and another 180 days here. And this is when I was doing like sort of like night shifts and stuff. And you know, I'm like the first person to admit that having regularity around sleep can be really challenging. But when you do have regularity around sleep, as I have for like maybe more regularity over the last sort of like 2, 3 months, one starts to feel better, have more energy. So like having regularity around sleep is probably one of the most critical things that anyone can do, because it entrains your circadian system and all of the things follow thereafter. So I'll sort of stop here, and Callie, I'll sort of pass it on back to you for any questions.
Yes, no, we're already getting some wonderful questions, so keep those coming. Thank you very much. And Mark, I want to highlight your question here that this is something that happens for a lot of our patients. And so, Sahil, I want to ask you, we often see people come to us and they say, listen, I sleep pretty good. I wake up and I feel refreshed, but my spouse says I snore or maybe witness a little bit of, apnea or difficulty breathing. And so Mark mentioned that he agreed that a sleep study would be a great idea, and we agree as well. But I also want to bring up that topic of how come people, when they do have sleep apnea, say, I actually don't feel that bad, even with some sleep apnea and sometimes even severe cases. Can you give us a little bit more information about why that sometimes happens?
Yeah, it's a really good question. And I was recently taking care of an individual that many people might know who is 60s, uh, sub 10% body fat, taking testosterone, extremely fit. VO2 max is high. HRV was low, and because the HRV is low, um, that's why they end up doing a sleep study. When we did a sleep study, we discovered that they snored, and and he was asking the same question. This person's a physician, and they were asking like, "Do I feel so good? Like, do I even need to chase this sleep apnea that I have?" And and it comes down to like what is the significance of the apnea? Because apnea is not a binary diagnosis. Is it mild or is it moderate or is it severe? And if it depending on the stages of sleep and the kind of drops in oxygen saturation one has, that is what dictates what should happen. But he was just compensating really well. All of his other physiology was in such phenomenal health that even though this person had moderate to severe sleep apnea, they were compensating well. If the same individual was not on testosterone, was not living a healthy lifestyle, had obesity and other medical conditions, they may not compensate as well. So the body is phenomenal at compensating. That's one reason, Mark, why people may still feel well because they're able to compensate. The second is they may just be a good sleeper. And we see this often when we do sleep testing, where you do a sleep study and their sleep architecture is generally preserved, meaning they go through being awake to light to deep to REM, and there's not a lot of what's called fragmentation or like major blocks of awakening throughout the night. So their architecture of sleep is preserved, the distribution of the sleep stages, like 10, maybe like 15 to 20% deep sleep, 20, 25% REM. The remaining is light. That's preserved, but they still have apnea. And that's a different person. So that we call that sleep apnea with preserved sleep quality. That's a very different person than someone who might have sleep apnea with reduced sleep quality. That's an example of someone who, as long as they can remember, decades. They've been a light sleeper. They've had fragile sleep. Their sleep is kind of choppy and fragmented. if they travel, they sleep in a new environment, they don't sleep as well. And now this person who gets mild or moderate or severe sleep apnea or is a snorer, they develop way more dysfunction because their sleep was poor to begin with. So the long-winded way of saying that if you have preserved quality of sleep, my attending used to use the term glue. Like these people have a lot of good sleep glue. Like their sleep is really well preserved, but they snore and they have sleep apnea. Versus someone who has very little sleep glue, their sleep is choppy, it's fragmented, and now they have sleep apnea. This person is going to have much more dysfunction during the day than the other person. Whether or not to treat, that's a separate question, and it really depends on like the nature of the sleep study across multiple nights. But it's a really common question, and we get that often in clinic.
Yeah, that was a really good one. And it's also important to remember too that sleep apnea usually happens over time as well. You don't usually go to bed one night not having sleep apnea, and then the next night you wake up and you do. And if that were the case, then you would be able to kind of feel that discrepancy a little bit more. But when sleep apnea usually does occur, it usually starts very mild and can kind of build over time. And so people can come kind of adapt to the sleep that they do have as well. And sometimes we do see patients, if they do get their sleep apnea treated with a CPAP or other device, that they start to feel better and didn't recognize how poor they felt before the sleep study diagnosis. Yeah.
Yeah, no, 100%. The other metaphor that I like to use in these situations is kind of like when someone has a cataract surgery. So I'll use myself as an. I went to Warby Parker to get a new pair of glasses the other day, and I thought like my when I something is close, I thought I could read it fine. But when they do like the experiment of say, hey, which is better, that's when you realize like, oh wow, like I actually did not see as well as I thought I did.
Right.
And so like I think sleep is the same way. Like we can compensate, we can function, we can do all the things that we need to do, but we don't understand how dysfunctional our sleep is until it becomes better. And so yeah, that's definitely like another reason.
And while we're still on the topic of sleep apnea, there was another question. What are some treatments aside from the CPAP machine? Is there anything else out there that can help sleep apnea?
Yeah, there is um so the question that I like to ask patients and myself is like, what do I think is the root cause and the driver of sleep apnea? Because that's how we think about the different therapeutic solutions. In a traditional model, sleep apnea equals a CPAP machine, irrespective of severity. Um, Dentists are more progressive and they implement appliances much more rapidly than most sleep physicians might. And what's the root cause? Is it a obesity related driver? Meaning, how effective can weight loss be? Is it a craniofacial anatomical reason? It's like they have a deviated nasal septum, they have a small upper airway. In those situations, like surgical solutions can be really effective. Or solutions that improve nasal breathing, whether it's nasal sprays, saline rinses, these sort of strips that can help you breathe better. There are devices that stimulate the tongue intermittently during the day. It's like physical therapy for the tongue. It's an electrical device by a company called Excite OSA. There is myofunctional therapy. And then there are like, just sleeping more on your side. There are these dental appliances that advance the mandible. And most recently, there's a drug coming out, 8109. It's by a company called Apnimed, and they just, I think, went public. Um, and that's going to be a potential solution. And that basically changes the responsiveness of the upper airway muscles. So there's a lot of solutions available for sleep apnea. And kind of like if someone has hypertension, we don't ask the question of like, do you need a beta blocker or an ACE inhibitor or it's like what combination of things will help you have good blood pressure control. And similarly, like looking at sleep apnea is the same way. Like what combination of these solutions will help you like breathe better at nighttime? And like tracking really makes that accessible.
Thank you. And I'm sure there might be some more sleep apnea questions, so we absolutely might come back to that topic. But I'd also like to switch to another question that has to do with circadian timing. So is it true that people who have very individual sleep chronotypes night owls versus, early birds. Can they change that at all? Can they force themselves to sleep in a different way? And is that healthy for the body?
Most the way to gauge circadian resilience, that's like the term that I like to use with patients. Like, how resilient is your circadian rhythm? Like when I was in my 20s, like I had a lot of resilience in my circadian rhythm. We would
There's a lot of
go somewhere.
resilience in our 20s, isn't there?
Yeah, no, for sure, right? And there was the circadian rhythm, like I would compensate from jet lag much better then than I do now. We had this trip to Europe with the family, and I was much more tired than I usually would have been if I was in my 20s. So, our, for most people, our circadian rhythms, there's an elastic nature to it. It can move in either direction depending on the uh, outside variables, light, primarily darkness, light, food, exercise, and then lastly, genetics. So the genes play a role. People will sometimes like ask, you know, I've been labeled as a night owl, and that becomes like their anchor to be a night owl for the rest of their life. But most of the time, these circadian rhythms can be shifted in either direction by changing our behaviors and exposure to darkness and light. There is a genetic component, but like there's a big whole host of other components too, like darkness, light, exercise, and food. So, um, our circadian rhythms are nimble. They become less nimble as we get older. Um, but definitely they can change. Like if you can accommodate to jet lag, you can change your circadian rhythm to where you want it to be. And it just requires a little bit of discipline.
Lydia asked a really good question. It's actually one that we had gotten before. And this is kind of the magic question for a lot of people. Now that trackers have become so popular, people have Apple Watches and Oura Rings, and they're able to see a little bit more of their sleep metrics. And for some people, they might notice that their deep sleep is not in the proper metric or alignment of where it should be. Do you have any tips on how to increase the amount of time that someone spends in a certain stage of sleep?
Yeah, it's a great question. I get this often, and instead of asking the question like, "What can I do to improve it?" uh, what we like to ask is like, what do we think is the root cause of it being low? And uh, if you figure that out, then you can improve it in a more precise way. And if you look at the physiology of deep sleep, slow wave sleep, it primarily occurs during the first half of the night. So an easy thing to do is to during, go to bed when your body goes into like the biologic night. Like when it's about when like the body has a biologic day and a biologic night. So when we're shifting from like it's our body's daytime to nighttime, during that first half of that nighttime is when most of the deep sleep should occur. So if my nighttime starts at 10 and I'm going to bed now at 1 a.m. for like 1 or 2 days, I've robbed myself of a disproportionately higher amount of deep sleep that I would have had otherwise. So going to bed at a consistent time is probably one of the most important things we can do. Abstaining from alcohol, abstaining from a heavy meal, and having like a proper wind down routine are probably the most effective in the absence of disease, are probably the most active, most effective tools to improve deep sleep. If there is pathology in sleep, meaning there's sleep apnea, there is sleep onset insomnia, there is restless legs, there is some kind of a nutritional deficiency, there is hormonal imbalance, then in those situations, like identifying the root cause and treating that makes the most sense. And let's say you've done everything from a circadian sleep hygiene standpoint. You had a sleep study done and you've ruled out that there's no obvious sleep disorder. You've had a comprehensive blood panel done either through your PCP or superpower or ultrahuman or not ultrahuman function, something along those lines, and there's nothing obvious. Then you can start to explore um, different solutions, whether it's prescription medications or peptides or something along those lines to try to modulate these numbers. But most of the time there is like a root cause. There is like a driver of a reduction in deep sleep, and it is usually modifiable.
And on that same topic of how a lot of people are getting more information about their sleep through wearable devices like Oura Rings, Apple Watches, these consumer wearable devices, how much stock should we put in these consumer wearable devices? For example, if it's telling me that I'm supposed to get 20% deep sleep and I'm getting 18, is that something to really be concerned about?
It's a so what I tell patients is uh I think like if let's take a step back. So when we look at the sleep staging that is usually displayed in the wearable apps, like the companion apps, it does not take age into account. So like when I slept when I was in my 20s, I had a different amount of like the amount of slow wave sleep and light sleep that a 25-year-old gets is different, physiologically different from a population health standpoint than like an 85-year-old. As we get older, REM stays roughly the same. Light sleep goes up, being awake in the middle of the night goes up, and deep sleep substantially drops. So, the first question that I always ask is like, how old is this person? Because that is how I will sort of gauge what is like a realistic goal for you. The other sort of question to ask, and I think this is where longitudinal tracking with a wearable device becomes really helpful, is if 5 years ago I had 20% deep sleep and now I have 10% deep sleep, man, something is wrong. Something is really wrong with my physiology. But if I have 10% deep sleep now and 15 years ago I also had 10% deep sleep and I still function well and my health is optimal, then I will be less concerned. So like the targets that I choose for that I help patients choose really depends on like what is going on with them. But I don't like pick a target and use a drug to achieve that because I think that's not the right approach. Um, it needs to be personalized to the individual based on their history and their age and all of the other medical conditions that they have.
Yeah, I know I've heard you say before too that these devices, these wearable trackers, they're a great way for people to learn a little bit more and they might even find something abnormal with their sleep that they may not have before. But it's also kind of important to realize that these are just consumer wearable devices, not necessarily medical grade studies. And you're right, they're not tailored specifically towards you. And so it's great for a little bit more information, but can warrant a conversation. Don't get too upset quite yet if those numbers don't read out what you were hoping.
Yeah.
Now,
What I would sorry, really quickly add is
no,
like
go
if
ahead.
you have a wearable device and your wearable like and this happens like maybe 10% of the time in a clinical population where patient has a Aura device and their sleep score consistently is 80, 90%. And but they have underlying sleep apnea. They're just a good sleeper and those numbers that those black box numbers are closer to normal. But then you do a sleep study because the patient says, "Hey, I'm tired." They say my spouse says I snore. My spouse says that I'm concerned about, John Doe's breathing at nighttime. And you do a sleep study and they might have like moderate sleep apnea. So having a wearable device, all that tells you is like what is like the general quality of your sleep, but it does not rule out the possibility of having like a breathing disorder like sleep apnea, which results in all of these downstream chronic conditions. So if someone says that they're concerned, or if you don't feel rested, even if your wearable device metrics are good, I would still do a sleep study. And if your wearable device metrics are lousy and you don't feel good, you should do a sleep study.
Great tip. Great tip. Now, I know that there's a lot of rage right now with things like peptides and supplements. There's always like quote unquote the magic pill. Everyone's kind of searching for that one thing that is going to help improve sleep or deep sleep. Can you talk briefly about supplements? What kind of role do they play in deep sleep or just improving the quality of sleep? Is that the first thing that you go to, the last thing, et cetera, et cetera?
Yeah, no, people can sometimes have a very long list of um, supplements that they can't even put into like an intake form. It can be pretty wild, and um it's the way to think of this is the way that I would invite you to think of this is, are you is the question to mitigate pathology, or is it to optimize physiology? And like if someone has like a pathologic problem, uh like they have sleep apnea, they have chronic insomnia, they have restless legs, they have a nutritional deficiency, they have something along those lines. Uh, I have yet to see a consumer solution like a mattress or a supplement or a peptide fix their problem. I'm not saying that it can't happen. I'm sure there are rare instances in which this could be beneficial. But in the situation that their sleep is healthy, reasonably healthy, meaning it's like free of any obvious disease, in those situations, doing a trial with some form of a supplement could be useful. And what I typically tell patients is try it, see how your sleep changes. Try to do this in a experimental fashion, meaning don't take like five things at the same time and say that it was this one thing that worked. Like, let's be realistic that, hey, there was five things that happened. It could be any one of these five, and see what works. Uh, but whether it's like L-theanine, apigenin, magnesium, there's so many different cocktails of solutions available with like mixing and matching. Some have melatonin, some do not. So uh, for us, at least in clinic, we're taking care of, by the time patient comes to me or you or any of the other docs in clinic, they have usually tried a variety of other things. And usually they have like an untreated, undiagnosed sleep condition, sleep disorder. And in those situations, I have yet to see like a supplement move the needle for them.
And even on that topic of supplements too, what might work for somebody, for example, they start taking magnesium and they do sleep better, may not necessarily work for the next person either. And so even though we do have supplements and peptides and things like that that can improve sleep in some people, we're yet to kind of find that, again, that magic pill across the board.
Yeah, I have, experimented with these different, particularly DSIP. It's a deep sleep inducing peptide, and but this was after like we did everything else, right? Like we did. This person had, I think they were in their mid 50s. They had sleep apnea. They, we got them a mandibular advancement device. Sleep apnea was resolved. Deep sleep was still low. This person was a ultra high performing individual. They also travel like across transatlantic like once a month. And so like to mitigate, to acclimatize faster and to bounce back faster from jet lag, to getting the restorative sleep as quickly as they can, like then these things can be added as a part of the stack, but it's like never like the first thing that it's never like a point solution. It's like something that it's a conclusion that one comes to after trying a variety of other things, not the first thing that one comes to.
I want to back up a minute. I had this question written down and I was going to ask this as the first question, but then I saw some wonderful questions in the chat. But I want to ask you, Sahil, what is your interpretation of good sleep? Is it time in bed? If someone gets 8 hours, does that mean they're a good sleeper? What is your definition of good sleep?
It's a byproduct of two things, at least. The first is there a healthy circadian system? Like, is there regularity with that? There needs good sleep is a healthy circadian system, coupled with uh, near normal physiology during sleep. Okay. So what that means is like there's regularity, like sleep, that person habitually goes to bed around the same time, habitually wakes up around the same time, and their body clock starts to naturally do that for them. That's step one. And then what I mean by healthy physiology during sleep is that they're giving themselves like a duration of like somewhere between 7 to 8 hours. Their architecture of sleep is generally preserved, meaning they have, depending on the age, somewhere between 15, 12 to 20% deep sleep, about 20% REM. The rest is light. They may have a few awakenings that are very brief that they may not even recall. And they go to bed easily, sleep is consolidated, and they wake up rested. And they're able to then function. Because at the whole, if you think about what's the function of sleep, at least from a day-to-day standpoint, it's like I want to be able to function well and uh, have enough energy to do the things that I want to do. So like having like that physiology at nighttime with having those goals achieved during the day, that to me is like what healthy sleep should look like. Because it serves a function, right? It's serving a function for us to be able to do the things that we want to do during wakefulness. The purpose of sleep is to have a good wakeful life. And the purpose of sleep is not to have good sleep. The purpose of sleep is to then be able to do all the things that you want to do when you wake up.
Absolutely. Now, I have one more question that I want to bring up here. I know we're getting a little low on time, but we had talked about sleep apnea previously, and it even mentioned some of the other devices or modalities that can improve sleep apnea. And Dr. Pam had a question about the NightLase procedure specifically, which is a laser procedure for the floor of the mouth, the soft palate, and the tongue. Have you ever seen this as a standalone AHI improvement, or is it usually combined with things like jaw repositioning?
Yeah, that's a great question. For those of you who are not familiar with it, it's basically like a laser tool that changes uh the collagen and like the density of like that soft tissue. And that this kind of tool, this kind of laser can be used for tightening muscles or skin in a variety of different places. So one of the applications of it is to use it in the back of the throat as well as in the nose to reduce the size of turbinates in the back of the throat to change the composition of the soft tissue in the back of the throat. And the idea is if the airway is less collapsible, there is less sleep apnea. And so, I've seen it being used. So if you look at there are some research papers. Last I looked was maybe 6 to 12 months ago in the setting of like snoring and mild sleep apnea where it could be useful. But I think the prerequisites are like this person should be a primarily nasal breather. Um, the driver of this is primarily upper airway. And uh, but as a standalone therapy in someone who is obese, mouth breather, searching for a solution, like this is unlikely to be like the definitive point solution to fix severe sleep apnea. So, like it can be used in someone who has like mild sleep apnea, snoring as a possible point solution. But usually, I would expect it to work in conjunction with other tools. And the best way to measure the efficacy of that is just doing like a pre and post sleep study to see, like, 5 nights of sleep testing before and 5 nights of sleep testing after like these sessions have been completed to see if it like made a difference or not.
Wonderful. I want to thank everybody for all the questions that they submitted, and I wish we had time to talk about this for hours and hours. I know I could, but I want to kind of wrap this up, and I just want to ask you, if you were to, have people take one thing away from this webinar about how they might improve their sleep. You have kind of previously talked about it before, but what are the kind of the number one, number two tips that you give most people to improve the quality of their sleep?
I would say don't obsess about your sleep, but make it a priority. Um, like you go back to the Disneyland analogy, and if your goal is to live a healthy day, like you need to have healthy sleep. And so making it a priority from that standpoint is something that I sort of preach as much as I can. And the way to do that is by having like healthy sleep patterns, um, track your sleep if you can, and if you don't feel rested, do a sleep study because like that is the only way you will be able to figure out what is happening to your physiology when you sleep. So have healthy patterns, give it some level of respect and priority, and then get a sleep study, or talk to your provider. We do these complimentary visits for anyone who comes to the website. You can just talk to someone like Callie or some of the other coaches completely for free, no strings attached, to share what is going on, and um, and then you can decide like if you want to do a sleep study or not. But talk to a clinician, talk to someone who, if you don't wake up rested, that's not normal. It's kind of like saying, like as a pulmonologist, if a patient comes to me and they can't breathe easily, something is wrong, right? It's such a core basic function, being able to breathe, being able to go to the bathroom, being able to stand up. These are such like basic core functions, and sleep is also one of them. Nature has like designed us to be able to fall asleep easily, stay asleep, and wake up rested. So if that is not you, something is probably wrong, and please like look into it, because if you fix it, you'll feel better.
And on that topic, I want to say that this is one of our first webinars here at Empower Sleep. We're going to be doing many more. And so keep an eye on our emails for other topics that we're going to have in the future. And if anyone does want to discuss their sleep or wants to learn a little bit more about how a sleep study might work, feel free to visit our website, empowersleep.com. And as Sahil said, we do offer a complimentary intake visit to just have that conversation and determine what are some next step options out there. All right. Now, I believe that we recorded this webinar. So if someone does need that recording, feel free to reach out and let us know via email. And again, we will be holding more of these webinars in the future. So keep an eye on these emails for future topics that might interest you. Sahil,
Thank
I
you,
want
guys.
to thank you so much for your time. This was wonderful. We'll continue doing this. I'm sure there's lots more questions out there. And I really appreciate you having this conversation so openly. So thank you for your time.
I really appreciate everyone who joined. Thank you so much, guys, for joining, and I wish you all the best. Bye bye.
Thank you all. Bye bye.